In today's Health Alert, it is National Prevention Week, a time to focus on preventing substance use and promoting mental health. New research makes this week even more important, revealing the number of people using illicit opioids may have been significantly undercounted. Our Chief Health Editor, Dr. Partha Nandi, joining us now. And Dr. Nandi, the importance of this study during National Prevention Week, we need to talk about it.
Yeah, it's huge, right? As a physician and a parent, I believe it's super important to speak openly about the opioid crisis in our communities. The published study, Glenda, shows that far more Americans are using illicit opioids than we previously thought. And researchers found that, get this, nearly 1 in 10 adults reported using non-prescription opioids in the past year. And more than 7% said they use illicit fentanyl. And that's a synthetic opioid up to 50 times stronger than heroin. That's big time. What's especially concerning is where this begins. And we were talking about this before the segment, that the study showed that around 40% of people began with a legitimate prescription from a doctor. Another 36% started by using someone else's prescription. And even more troubling, most users don't think they're at risk. In fact, only 5% believed an overdose was likely. And the study also showed that men, Black communities, and younger people are using illicit opioids more often, which shows how this crisis affects more groups more than others.
So despite this study showing that illicit drug use is up, the CDC also saying that it's down in terms of deaths and overdose deaths. So how do we interpret that?
A little silver lining, right? So yes, the new CDC data reports that the largest one-year drop ever recorded, 30,000 fewer deaths than the year before. So that's great news. It's real progress, but unfortunately, about 80,000 people still die from overdoses. Way too many, in my opinion. And overdoses are the leading cause of death for people aged 18 to 44. That's unbelievable still to me. So what can we do, right? First, educate people of all ages that these conversations should happen in homes, in schools, and in healthcare settings. And secondly, be careful with prescriptions, right? Ask questions, weigh risk, and consider other safer options when possible. And third, we have to support people who are struggling with compassion and not judge them. Addiction is a health issue, and recovery is definitely possible. People need access to treatment and understanding along the way. And National Prevention Week, hey, it's just a call to keep talking, keep listening, and keep supporting each other. I think that if we talk about it that way and look at it as a disease state and that we can treat instead of judging, I think we'll go a long way.
Yeah, that mindset helps change the narrative.
Yeah, and I think what we're talking about is use other alternatives whenever you can.
All right, thanks a lot, Doc.
Hey, my pleasure, of course.
This week on the Dr. Nandi Show, with Alzheimer's on the rise, many Americans fear losing their memory. Dr. Nandi has strategies on how you can avoid the frightening disease. Tune in this Saturday at 5 p.m. Dave.